Story is that there's a gland behind your eyes called the pituitary. Has anyone heard of that gland? Okay. So it's sometimes called the master gland, and it controls other glands in your body, like the thyroid, for example. It also controls the sex organs, the testicles, to make testosterone, the ovaries to make estrogen. And so normally there's signaling happens, and that's what initiates puberty, and then through adulthood, you have these hormones starting. Next slide. Now that's a mouthful up there if you can see it, hypogonadotropic hypogonadism, which basically means there's a blockage there. Right? The pituitary is not sending the signal out. And this is a medical condition that endocrinologists like myself would work up and treat. There's something wrong with the pituitary. It's not sending out signals. And so we're going to treat that by either helping to fix the pituitary or having them get hormones of their actual sex. Next slide, please. Okay. Are there any medications which can cause this condition? There are. Has anyone heard of Lupron before? It's a prostate cancer medication. Why does that work? Well, if you give that medication, it actually blocks the pituitary, and it prevents in the male from making testosterone, and that helps prevent basically the spread and growth of prostate cancer. So there's a legitimate use for doing this in medicine. It's also used for endometriosis, or sometimes kids start puberty at a very young age, say 4 years old. These are all labeled uses by the FDA. Next slide. What about using it for kids, say they're 12 or 13 with this gender confusion? What about stopping puberty so that they can become the opposite sex, theoretically? Is this FDA approved in any way? Has it been tested? It has not. You know, there are a lot of people talking about conversion therapy, and we have to ban conversion therapy, and they're never clear what that is. But here's a clear conversion using chemicals of a person's body, which is extremely harmful. Next slide, please. So what are the effects? Now, the Endocrine Society, which I referenced earlier, and their guidelines, which are all low-quality evidence, say that as soon as the kid develops this and starts pubertal development at Tanner stage 2, that's when you give these medications. What's going to happen? You're going to stop pubertal development. You're also going to inhibit normal brain development and bone development, which I'll talk about. And importantly, they won't come to that stage to become fertile. So long as they're on this medication, they're infertile. If they continue on to hormones, they'll remain infertile. If they have surgery, they'll be sterilized. This is a path towards sterilization of kids. Next slide. Now, how young are these being given? Basically, this is right here in our state, UC San Francisco. Elena Scherer at one of their gender-bending conferences discussing how young would kids get this.
As far as starting blockers, generally blockers are started at the first signs of puberty. It often can start like as early as like 8 at times, or 9. And so those are kids who are going to be like in 3rd or 4th grade.
And she states flatly that they could be as young as 8 or 9 years old. They could be in 3rd or 4th grade. And think about what you were doing at that time. Maybe pretending you were a knight or a fairy, or I was under my coffee table. I thought I had a rocket ship and I could make it to Mars. I haven't made it. But the point is, you know, kids fantasize, and it's normal. When should we start taking that as gospel truth and giving them these powerful medications? At UCSF and Children's Hospital Los Angeles, 8 or 9 is just fine with them. Next slide, please. What are the consequences of giving these medications to males? On the left, you're going to stunt growth of their organs, just as I said. They're going to develop sexual dysfunction because the organs never developed correctly. They're going to prevent sperm production, as I said, and disrupt normal brain and bone development. For females, at a young age, they'll actually acquire a menopause-like state because they're not getting proper hormones. It will block normal breast development. They'll also have sexual dysfunction. You'll also cause infertility, as I said, and affect bone and brain development. Next slide. What about effects on the mind or on the brain? As I said earlier, these kids are coming, look at one study, 70% of them already had some sort of underlying psychological condition, autism and such. What effect does it have on the mind? I pulled actually the first three, it's probably hard to see, but from the labeling, emotional lability, mood changes, headaches, nervousness, anxiety, agitation, confusion, delusions, insomnia, depression. It even says monitor for development or worsening of psychiatric symptoms. Use with caution in patients with a history of psychiatric illness. Does that sound safe to you for these kids? In the UK, they're doing very good work uncovering what's going on at their gender identity service. Professor Biggs out of Oxford, through Freedom of Information request, got some further information for what they're doing there, and he found that there was no statistically significant difference in psychological functioning in blockers versus support. So whether they got blockers or they were just psychologically supported, there was no difference. It wasn't really helping them. Children actually reported greater self-harm. You've heard of kids cutting or doing things like that. The incidence went up. And girls exhibited more behavioral and emotional problems and greater dissatisfaction with their body.